Welcome to the Bowringer Academy Parasite webinar series. In today's webinar, we'll be discussing lethal lungworms, and the focus will very much be on dogs in this session. While cats can get a type of lungworm called a Lura-strongylus, the dog lungworm, Angiostrongylus, is much more common. So in the first part of the webinar, we'll discuss the problems that lungworm can cause. We'll then move on to the lungworm life cycle, and we'll finish with the advice that we can give owners about how to prevent lungworm disease in their dogs. So, what is the big deal about lungworm? So actually there are several species of lungworm that can infect dogs, but it's Angiostrongylus vasorum, also known as the French heartworm, that causes the most concern in dogs. So Angiostrongylus vasorum is a small worm measuring up to 2 centimetres long, and it lives in the heart and lungs of infected dogs and foxes. Infection with Angiostrongylus vasorum causes lungworm disease, also known as angiostrongylosis, and this is a serious disease that can be fatal. I'm sure many of you will have seen dogs with lungworm in practice and so understand what a devastating disease it can be. It presents in many different ways, but most commonly we see respiratory signs. So typically this is coughing or dyspnea. Lungworm can also interfere with blood clotting, resulting in hemorrhage. So you may see bruising, increased bleeding after surgery, or sometimes bleeding into the sclera, the whites of the eyes. And occasionally we also see neurological signs. Less specific signs like anorexia, depression, or exercise intolerance are also reasonably common, and this can make diagnosis especially difficult. So over recent years, lungworm infection in dogs has caused increasing concern in both pet owners and in vets. And this is because of the potentially severe clinical signs that we see, and also because of its apparent spread. Although some of this spread may be due to better awareness and testing, we know from data in foxes that there has been spread across the UK and Ireland, and so this is a genuine spread that we're seeing. Firstly, looking at Great Britain, this table compares the prevalence of lungworm in foxes in 2006 with the prevalence in 2014. And you can see from the table that the prevalence has increased in all areas of Great Britain, and also that lungworm is spreading northwards. In the Republic of Ireland, you can see from the map that lungworm has been identified in every county. And the overall prevalence of lungworm is 40%, which is actually the second highest in Europe. So there is strong evidence that lungworm is spreading across the UK and Ireland, and that dogs are now at increased risk of becoming infected with lungworm. So let's now move on to the lungworm life cycle. So this image shows the life cycle of Angiostrongylus vasorum. So if we start at number 1, lungworm larvae in the environment are ingested by slugs and snails, and these are the intermediate hosts for lungworm. When a dog then eats an infected slug or snail, the larvae can then enter the dog. At this point, the larvae migrate to the heart and pulmonary artery, where they develop into adults. Adult females then start to lay eggs, and these eggs hatch in the lungs and develop into larvae. The larvae are then coughed up, and then they're swallowed, and they travel through the intestinal tract and are finally passed in the faeces. And then the cycle begins again. The pre-patent period of Angiostrongylus vasorum is 6 to 8 weeks. So this is the time from when a dog eats an infected slug or snail until larvae are passed in its faeces. So this is from number 2 to number 5 on the diagram. Many owners will be unaware that their dog is eating or coming into contact with slugs or snails. And although some dogs do eat slugs or snails on purpose, it's more likely that they're eaten accidentally. So this could be through scavenging or eating grass. And we especially see this with the smaller slug species. Dogs can also become infected by licking a slime trail or by drinking water where an infected slug or snail has been. And amazingly, in endemic areas, up to half of slugs are positive for Angiostrongylus vazorum DNA in the late summer and autumn. So what advice can we give to owners about how to prevent lungworm disease in their dog? As always, when we're making a recommendation about preventative worming, you first need to assess all of the risk factors that are relevant. So in the past, location was an important risk factor to consider. But now that we know that lungworm has spread across the whole of the UK and Ireland, treatment is increasingly justified in all locations. But there are other risk factors to think about. So dogs under the age of 18 months are significantly more likely to test positive for lungworm. And this is probably because of their increased investigative behaviours, which can lead to increased exposure to infected slugs and snails. But do remember that dogs of any age can become infected with lungworm. Breed associations have also been reported, but not consistently. And time of year has also been considered a risk factor, but there's currently little evidence for this, as dogs are being diagnosed with lungworm throughout the year. We can advise owners on what they can do to reduce the risk of their dog becoming infected with lungworm, such as avoiding off-lead exercise in damp weather after dark when slugs are more active, or avoiding outdoor feeding. But it's unlikely they'll be able to prevent their dog coming into contact with infection in endemic areas. If a pet is deemed to be at risk of lungworm, then they require a monthly treatment with an appropriate product. This is primarily to prevent lungworm disease, but also to stop the larvae shed in the faeces and therefore reducing environmental contamination and therefore stopping spread to other dogs. Eric Morgan, who is a professor in veterinary parasitology, has said, "You don't want to wait until you see sick dogs." And by this he means that dogs that are at risk of lungworm should be treated with a preventative product rather than waiting until they get disease. So, how does monthly worming prevent angiostrongylosis? Well, if we worm a dog at the beginning of the month, it's possible for that dog to become infected with lungworm shortly afterwards, as wormers don't have a residual action. If this happens, 6 to 8 weeks later, we reach what we call patency. And this is when we see the larvae in the faeces. And generally, this is also when we see the early signs of lungworm disease. If we had wormed that dog again 1 month later, i.e. within the pre-patent period, this would have killed the lungworms and therefore stopped the lungworm life cycle before patency was reached, preventing infection from progressing to shedding and clinical disease. If we then continue to worm monthly, infections will never be able to reach patency. So worming within the pre-patent period kills Angiostrongylus vazorum before they can become adults and prevents angiostrongylosis. And this is the same no matter which of the licensed products you're using. It's also worth pointing out that if an owner forgets a dose, it's possible that their dog can become infected with lungworm shortly afterwards and they can then develop lungworm disease before their next treatment, as it only takes 6 to 8 weeks for clinical signs to develop. So, to prevent lungworm disease, dogs definitely need to be treated monthly. And as I've already mentioned, we also need to use an appropriate product. So the currently licensed products for preventing lungworm disease in dogs are those containing milbemycin oxime or moxidectin, both of which are highly effective. And as we said before, dogs can be diagnosed with lungworm at any time of year. So at-risk dogs should be treated monthly, all year round and lifelong. So to summarise, lungworm disease is a serious disease and can be fatal. Angiostrongylus vazorum has spread and is now found throughout the UK and Ireland. Infection is hard to avoid, and therefore monthly worming with a licensed product is recommended to prevent disease and stop the shedding of larvae in the faeces. I hope you enjoyed today's webinar on lethal lungworms, and if you'd like any further information about parasites, then please visit the Bowringer Academy at www.bowringer-academy.co.uk.